I was Navy, active duty Navy, and I was trained here in Jacksonville, University Hospital. And when I finished my Navy payback here in Jacksonville at the Naval Hospital, I was invited to join the practice. Two of my co-residents, Drs. Hartley and Woods, were part of North Florida Oral and Facial Surgery, and I was invited to join back in '96. All right, well, we pride ourselves at North Florida Oral and Facial Surgery on customer service. The patients are all individuals with different needs and different levels of anxiety when they come in their office. We try to put them at ease immediately by greeting them with a smiling face as soon as they arrive. Well, each individual patient is different, and they require different approaches, whether you have the elderly patient or the adolescent patient. So I find that I get a lot of enjoyment about getting to know the patient initially at the consultation. Frequently we have nervous patients that come to us. There's a fear of the unknown and the anxiety about going through a surgical procedure. And part of the way that we help relax those patients is to just give them a little more time and personal time and conversation rather than just cut to the chase and talk about clinical things. Try to get them to talk about themselves a little bit. And then, of course, we're all very talented in doing anesthesia. And that's one specialty that we can offer our patients where we can put them to sleep. We can use IV sedation or general anesthesia. So those patients that don't want to experience anything after they come in, we can offer them that level of care. And we're very safe about how we do it. And all of us are fairly talented and have a lot of experience in that modality. We're all board certified oral and maxillofacial surgeons, and the board certification process is fairly rigorous. The initial board certification requires so many hospital cases that were done, an oral exam preceded by a written exam, and then we have to recertify every 10 years, and I just recently recertified in 2013. We maintain our competency in the newest standards of care and techniques by going to continuing education courses around the country. I'm a retired Navy veteran. I spent 12 years active duty in the Navy and then retired from the reserves in the early 2000s. And my father was a World War II veteran, so I have a big place in my heart for our active duty and retired military personnel. I do a lot of work with the wounded warriors, and I really get a great deal of satisfaction when I'm able to help those patients out, because their service for our country has been above and beyond what I can imagine.